I absolutely love working for community.
If someone came to me and asked me what it's like to work for a community health network, I would say that it's life-changing.
I work here because I wanted to make a difference. I wanted to be the change in a perfectly but so imperfect world. When I first came in for my interview, it was very calming. It was a calm environment. They were so nice. It was like, even when they were talking about the job and they were asking me questions, they just made me feel kind of like at home.
You get a ton of experience. If it's your first job out of school, you learn so much. You get to really be a part of clients' lives in a way that feels really special to me.
I'm passionate about the job because we work with individuals who are often forgotten and want to be dismissed by society.
I really have a passion for working with severe mental illness and dual diagnosis addictions is part of my role. And if I'm in a private practice, I'm not going to see that population. They're all, Medicaid clients. And so this is really the setting I'm going to be in if I'm going to be able to connect with that specific population that I feel so passionate about.
About 80% of my job is coaching. The hardest thing with dealing with people with mental illness is the lack of motivation. So you have to install that motivation into your client to get them to be the most successful person they can be.
It takes a certain something to work with this population. It takes a good degree of patience. I think it takes a sense of humor and a lot of compassion because our clients sometimes have some pretty unique challenges when you're dealing with severe mental illness. So I do appreciate about CSS that it feels like we're all in this together.
I go out in the community. I help them with accessing and obtaining their benefits, medication management, mood management, different skills of that sort.
I do find that this particular position in community allows me to be super flexible with my schedule, which is really a big part of why I came back to work here. For some folks, office-based is just so much a better fit. They come to you, that's a lot easier in some ways. But being community-based, I do appreciate being able, I think it's a privilege to be allowed to go into a client's home and see them in a vulnerable state and be part of their lives in that way.
When we're in a residence in their apartments, houses, etc., we understand what the challenges they may be facing. For example, some may not have running water, or some may have electricity that's been cut off.
We typically see about anywhere from 4 to 5 people a day. Some days are a little bit slower because they do have your client does have the opportunity to cancel on you if they don't fill up for the session.
I do like what I do in behavioral health. I think it's incredibly important. I think the clients that we are serving would not be getting services otherwise.
If you want a warm, calm, teamwork environment, dependable, supportive, community is for you.